Hello, welcome to the Manual Handling Collective. I'm your host, Simone Hepburn. I'm a physio and manual handling educator, and I'm passionate about injury prevention. This is a podcast where I speak frankly with the brain's trust of manual handling and other amazing industry leaders in and around the occupational health and wellness community. You get to meet them, you get to be inspired, you get to learn from their stories, and you get to stay up to date with the latest and greatest in manual handling and wellness. So let's crack on. Today's guest on the Manual Handling Collective is Professor McLean. Michelle has a PhD of Science and a Masters of Tertiary Education. She's had a long history in the academic world with various appointments around the world, some in South Africa, United Arab Emirates, and now for the last 10 years at Bond University here on the Gold Coast in Australia, which is where we met in the physio program and the medical program. So Michelle has written over 70 articles over about 30 years, mostly around medical education, but these days there's a little twist on the end of that we're going to talk about today. Traditionally in healthcare we've always focused on the health of humans, but now Michelle's going to tell us about this missing piece, which is the health of the planet. So let's get into it and crack into her big brain today. So welcome, Michelle.
Thank you.
So the first thing we want to know about is a little bit about you and your career journey and how you've come into the position now at Bond, Professor of Medical Education, and the creation of this new subject, Planetary Health. So how did you get here?
Yeah, long story.
But
yeah, I always say I had to go north to go south.
Mm-hmm.
So starting in South Africa, always wanted to come to Oz, thought this is probably where I'd end up. Didn't quite make the decision. There was a cutoff in terms of age, but it's working at med school in South Africa. It was University of KwaZulu-Natal. One April, I got an invitation that said, would you think of taking a job in the Middle East, in the United Arab Emirates? It's really lovely here. Yes, I've been there, worked my way up from just a leave replacement to a lecturer, senior lecturer, associate professor, and then finally full professor. And the last two were in education. That's where my work in education really started. I did want to go, after I'd finished my PhD in plant pathology, mycotoxicology, do clinical research. It just never panned out. So I call myself an accidental medical educator. It kind of went through that. In fact, there was lots of accidents along the way. It sort of did the Masters in Education and then just started working in curriculum development and that sort of stuff. But always interested in, I used to collect things as a kid, shells and seeds and you name it. I had it, even beetles and all that sort of stuff. So always in my blood to do that.
So there's always a bit of an environmentalist and a bit of a greenie in there.
Absolutely. And I always wanted to, when I was studying as a student, wanted to do marine biology because that was where I wanted to go. Love the sea, anything to do with water, snorkel, dive, swim,
And you're a nature lover.
I love, altogether. One of my colleagues got a job at Bond as the assessment officer, and then he said to me, "Hey, there's a job as a problem-based learning lead here at Bond. Would you be interested?" So did it. They flew me out, offered me the job, and
Great.
6 months later, I was at Bond, and that was December 2011.
Wow.
But I also then ended up teaching histology. Wherever I go, I seem to have to teach histology.
Back to the cells.
back to the cells. So where did Planetary Health come in? 2011, I wouldn't really have thought about climate change. Still loved the hiking, going out, doing stuff. Loved Binnabara. The hinterland's like my backyard. I feel it's like my backyard. And things just started getting worse and worse. And I just kind of thought, I really need to find somebody else in Australia who's on the same page as myself. So I ended up before I found this person, after the AMC, the Australian Medical Council, had come to accredit the medical school, I got identified as someone who wrote articles, did research, and so they put together this group of people who one was from each medical school. One was going to be curriculum and one was going to be research. And I was the research person for Bond, the scholarship. And the person who put it all together, I said to her, is there anybody else in Australia who's concerned around climate change and what's happening and preparing our students for the inevitable? And she said, yes, there is someone, and she's at Notre Dame, which is the other private uni, right? And Lynn and I, it's Lynn Madden and myself, we work very closely, and we've ended up as a medical deans group, working for their sort of the curriculum committee and having inputs into that. So that's kind of how that's on. And we've gathered people along the way, and it's now gone cross-disciplinary. So Kristen Mackenzie-Shelders is a dietitian at Bond. She's also really into this. And you pick up people along the way who you have never met.
You've started something, Michelle.
Who you haven't met. So started writing at invitations to write books, book chapters, for instance. You say, okay, it's not just about medicine. Healthcare is not medicine. It's everybody.
Yeah. So just taking back a step, I think traditionally people in healthcare thought about the health of the person, right? And that's sort of back in that 2011, and now it's being more commonly recognised that it's not just health the person we need to focus on, it's the health
so
the planet.
this is where it goes. This is where how it develops. It's always about climate change, global warming, and everybody. There's still groups who will just talk about climate change, but it's not just climate change. There's all sorts of other environmental changes that are happening called I call global environmental changes, and collectively, it's an ecological crisis. So we've got deforestation, we've got the pollutants.
I'll let you keep going, but I was reading some of this stuff, and I said to my children, my daughter's 10, I said, what else is there other than climate change? And she says, oh, Mum, that's easy. They're cutting down the trees. The water's getting polluted, and the air's got stuff in it that's making it hard to breathe. And I went, oh, she's 10.
And she knows about global environmental changes.
She knows about these things.
Yeah, they're all interconnected because if you cut down trees, the carbon source disappears. So carbon goes up. They sink, so it goes up, and that leads to global warming. And the oceans are sinks as well for carbon, and so that leads to acidification of the oceans and warming of the ocean. So the bleaching of the coral reef is because the 80% of the planet is water, and it's absorbing the heat. So the Paris Climate Accord says we need to try and keep it below 2 degrees, but preferably below 1.5. So there's major changes that have to happen in terms of carbon emissions to not have that happen. And 2000, Australia is vulnerable. If you look at the map over the last 20 years, you just see it getting from green to yellow to red.
Getting hotter and hotter.
2019 was the hottest and driest year on record in Australia.
Wow.
2020 wasn't far behind, but because we were all locked up, there was a lot. The air pollution wasn't as bad, and
the water got clearer in the canals in Venice.
Yes, all those sorts of things. Yeah, so we weren't burning fossil fuels and polluting our atmosphere. So back to your question about planetary health. What is planetary health? So for me, all medicine is public health, because we interact with our environment all the time, and what happens in one part of the world drifts across with currents in the water and the air and affects other people. So so we are part of an ecosystem as a human. We happen to be at the top of the food chain because we just consume almost everything else on the planet. But we're part of that ecosystem, and we have become disconnected from it for a number of reasons. And those reasons are technology. We just don't think about us being part of the environment. We've controlled it. It's there for us to use.
Yeah, human health and the health of the planet are separate things in some people's mind.
We're not in that ecosystem anymore, or those ecosystems. It's probably just easier to talk about a big global or planetary ecosystem. So planetary health, the term came about if you take the Western anthropocentric view in 2015.
It's fairly recent for
fairly recent,
people to get
correct?
their heads
Because
around.
it's now sort of like people saying climate change, and the people saying, okay, we're moving. It was called a manifesto to move public health to planetary health. So we can't. We're not just worried about the people. We are worried
people and the planet
yes.
together.
So in that definition, the Western anthropocentric one, all about me, us as humans, is we need to protect the planet, which we've degraded by deforestation and pollution and what have you, because our health depends on it. But if you take the other perspective, that of Indigenous people, and that idea of planetary health has been around for a very long time.
They're already all over that.
They have never disconnected.
Yeah.
They might have been forcibly removed in different parts of the world from their ecosystems, but they are still connected to land, country, whatever people call it. So in Australia, First Nation people say connection to country. And country is a person.
And I think in one of the articles you sent me by Clinton Schultz, as one of the authors, was saying, Indigenous people introduce themselves as, I am Simone, I am from this part of the country. I belong to this part of the country.
Yes. And
that's part of their identity. They are connected to that part.
I'm a Wajiri person, or I'm a Coomba Mary, or whatever, and this is where I'm from. Because everything that they do is connected to land. Their identity is there. It's a spiritual connection. So everything is wrapped up, the ceremonies, the storytelling, and for their existence, they relied on the environment. For their food, their water, the clean air that they breathed. They had controlled burns because they did regulate it in some way. We know that every year the climate is slightly different. So if it's rained a lot, there might be conditions. Yes, and or if it's very dry, they know if a fire came through naturally, they'd be in trouble. So you have a controlled burn. Thank goodness we're going back to that traditional knowledge now, because it's been there for 65,000 years, and we've just pushed it aside.
Yeah.
So in the first, when you say Indigenous people, I'm talking globally.
Yep.
That's how
any Indigenous population.
exactly. They have this connection with the land and the country, and it's part of their very being. So if you damage it, you're actually damaging it for yourself and everybody else, because it's not I, it's we. In Africa, we have a concept of Ubuntu. I am what I am because of others. So I don't exist as an individual. But Western society is very individualistic. And so when we think about that concept of planetary health, it's everything together. And Indigenous people around the world protect the environment. They're the traditional landowners and protect custodians, and they practice stewardship of the land. If they need, because the trees give them all sorts of things, the roots, the leaves, the bark, you don't kill a tree. You take a branch, you take a bit of bark. If you ring bark a tree, it mostly dies.
So just taking another step back to this subject, planetary health. So these are the future doctors of our health service. Can you tell us a bit about what they do in that subject, and what's the response been? What are the students saying, and what's been the response from other institutions?
Yeah, so I started around about 2017. I had an assignment, and it's just grown from there, just putting it across the curriculum. So Bond has signed up to the Sustainable Development Goals, and those are a group of 17 interrelated goals. They're called the global goals because we're all supposed to work towards them and do things. And SDG 3, so these are the 2030 ones. We had the 2015 Millennium Development Goals, but these are the 17 SDGs. So 2030 we should
meet those or make progress.
Yeah, and sustainability is written into that, because it says we need to do this not only for the current generations but for future generations. Because if we're on the same consumptogenic, resource-intensive path that we're on, we're already overshot. We overshoot our Earth, like Earth's overshoot day is in March for Australia. We've used all our year's resources by March. So we're just plundering the planet for more. I've just picked up an article now while I was waiting on plastic, how much plastic is produced per person per year. Australia is number one.
No
59
way.
kilos of single-use plastic per person per year. Next is the US at 53, and then Korea and the UK at 44 kilos per person.
Wow.
Single-use plastic. But you think how much wrapping and more wrapping,
We're going to get onto some solutions too, but just the planetary health subject and what's been the response.
Yes. So, I've taken SDG 13, which is climate action, and say you can choose one or two other SDGs. They're all interrelated, but we can't deal with them all. And develop a protocol of how you're going to address this, the goals and targets, and then you have a product. You have to produce a product. So we review their protocol, and they have to use systems thinking or design thinking, which is important in medicine, because in health, because the health is a system and it's got different components. And design thinking is if you're doing something for somebody, so you want a program for diabetics, for instance, that
you have to consult the diabetics.
Exactly. Stage one is consult the person, and so they have to incorporate that, which is an important skill
in medicine,
in health, to tackle problems in health, and they then have to produce a product.
Haynes Medical Australia are innately curious, solution-focused and always keen to share expert insights on keeping staff and patients safe. That's why today's Manual Handling Collective podcast is proudly brought to you by Haynes Medical Australia.
So in the UK, for instance, now UK is way ahead. So
really?
I'm going to talk about the health system here, because that's where it's kind of environmentally sustainable healthcare, but it's relevant for you for your the listeners around healthcare. And the UK has really taken big steps in this. They have a Climate Act, 2008 Climate Act, that says by 2050 we'll get net zero, right? And that's where
net zero is your carbon
emissions, net zero. So that's been around for quite a while. And the NHS and good people in that system have been driving it. So they now have net zero in the NHS by 2030.
Wow.
2030. In 9 years.
Do we have anything like that?
Nothing.
Okay.
Absolutely nothing. But to ensure that the students would be ready for that system where it's all happening, procurement, because that's a big one, the procurement, the transport, and of course
purchasing.
The waste.
And the waste management.
So their standard, they've got tomorrow's doctor, which is the GMC, the General Medical Council standards, and they wrote into I think it's standard 25, that by the summer of 2020, which was last year for them, September the start, which was all online, all curricula had to have sustainability written into it. So
Fantastic.
So they have to learn about climate change, they have to learn about environmentally sustainable healthcare. And there's a lot of work being done in healthcare. So it's happening. We're doing it in Australia in our different curricula without anybody telling us we have to do it. So it's being driven by champions doing it. Now, if I go, a lot of the bodies like the World Medical Association and the AMC and the GMC, they've all declared climate changes. Pharmacies declared a climate emergency. Everyone's done it. They've all said it's happening and we have to do something. There are other occupational therapy. In 2018, they put out their environmentally sustainable occupational therapy in the different domains, what you can do in teaching, in research, and in practice.
Great.
And physiotherapy has an Environmental Physiotherapy Association. It's
yeah.
being driven by...
I looked at that online.
Yeah, it's excellent.
I'll put some links in the show notes to some of these.
Yeah. So what I've kind of been active in this area, and I've been inclusive, as I've said to you, because for me it's interprofessional, multi-professional. It's not just medicine that has to. It's everybody. Health is everybody. Everyone works as a team. We have to get a consensus statement out around health professions education, and we did. It took 10 months of gestation. The person who was running it had her kid before. She was supposed to deliver after, but it came 5 weeks early and we were delayed. So there's this consensus statement.
I've got that. I'll put that in the show notes as well.
Learning outcomes, and anybody can take them. We've used the Sustainable Development Goals as one of the frameworks. So learning outcomes, examples of activity, examples of assessment, and so on. But a very interesting thing has happened is the medical students have what they call the Planetary Health report card. And they evaluate. It's in the US at the moment. All the medical schools of how much. And they give them an A, an A plus, an A minus, a B, a C, a D.
So a prospective student might choose an institution based on their efforts towards sustainable healthcare.
And it's freely available. You can go and have a look. Look at it if you look it up. Planetary Health report card. So they did one. It had about 6 or 8 med schools, and now they've got like 20 that have been done. And they plan to do it in Australia, and they plan to do it in Canada as well. So there's a lot of students driving this. The Canadian students, they're called HEART. They've designed all the learning outcomes, the Planetary Health learning outcomes for the Canadian medical curricula.
Wow, for themselves.
Yeah, not the professional organisation, but the student organisation.
It really sounds like the youth of today coming through are going to be better prepared to take this on. But can we switch now to like the workers of today? What are some things or solutions, ways they can get involved, learn more, do more? What can they do in their practice now in hospitals or healthcare?
So the hospital is quite difficult because it's big, right? And you have probably a CEO, and it's all about dollars, often. But what you'll find in those hospitals are champions who are driving it. So I've got a colleague who's got some students, MD students, doing theatre waste, and in one of those theatres is an anaesthetist who's set it up so that all the packaging goes into the right containers.
Okay. So a waste management system that's clear and you can follow. And
exactly. It shouldn't be him to do it. It should be coming from the
organisation.
The organisation. And until you have legislation to do that, it's not going to happen. So we don't even have a country that a prime minister that's prepared to say net zero by 2050, right? He's getting pushed to do it because COP26 is going to happen in Glasgow in November, and Boris has already had a word with him. Biden's got his climate thing going, So Australia's the pariah when it comes to climate change.
And what's the we touched on this bit before, but what's the contribution that healthcare is making towards greenhouse gases or carbon footprint?
If there was a study done in 2019 with healthcare without harm, and they looked at about 97 countries and calculated the footprints in various. They got their ways of doing it, but it's a comparative one. Australia ends up being one of the top 4 per capita emitters. If you take just the 25 million as a whole country, and you take China, is no comparison. But when you come per capita, that's then you can compare. So Australia's per capita one of the big 4, with US, Canada, and Switzerland.
Wow.
So
that puts an individual responsibility on people, doesn't it?
Exactly. And we think Canada and the US are always
big consumers,
but in the US it's like almost a private health system, right, rather than a public health system. And it's private is often for profit, so profit before planet, you know, that kind of stuff.
So just to confirm, you're talking about healthcare contribution, not the whole country's contribution.
No, healthcare contribution.
Yeah. Okay, got it.
And the average is about 4.4% of your whole country's healthcare takes on average of those 97 countries done. India's the lowest, measured at 2.8%
of the whole country's
of the whole country's carbon emissions, and Australia's about 7.5. And the UK is about 4.8. So we're almost twice the world average.
And twice the UK even, because our health service would be similar to the NHS.
But remember, they've been working on it and they've reduced it.
What are their secrets?
They have things in place that do it. You don't need, they have water, they have solar, they have water capture. They don't
in the hospitals.
Yeah, you don't. All the transport. They've got more bike parking. They've got green spaces. Their incentives to cycle to work rather than to ride to work. We've learnt that conferences have a big footprint. International conferences. You don't have to have a conference face to face these days.
We've learnt that now with COVID-19.
Technology has a footprint as well. So it's better that when you're talking to someone on via Zoom, you turn off your video. There's fewer emissions that come from that. You don't need to see everyone. It's quite distressing sometimes because people are doing all sorts of things. I was one the other day and they said to her, Will, whatever her name was, because she was like, it was her face right there, and then her cat was there, and then she dropped something, and then she's talking on the phone, and we say, please can you switch off your video? So yeah, it's just quite happy because you can listen. You don't always have to be seeing, because all you're seeing is faces. Like you don't need an 8x8 of people's faces.
I'm glad you mentioned conferences because a lot of health professionals are used to going to them. What are some other things that have changed with making conferences greener?
Food, changing the food. If you more vegetarian options. And because meat's got a big footprint, especially beef. If you have a look at like per kilo or per litre of something, beef,
okay, so you
cheese,
an environmentally sustainable menu.
Yes. My first thing is knock off beef.
Produce.
Yeah, knock off beef. And more people are becoming vegetarian. It's in fact in Australia, there's quite a lot more people, even more so than just vegetarian, vegan even. Yeah, food wastage is massive. If you and again, Australia is per person. If you would cry if you knew how much food was wasted, and think of the hospital systems and how much food is wasted. People get dumped stuff and they don't. So a lot of it is just you order what you want. Here's the menu, and it's made specifically for you, right? It's you choose a meat-free menu or whatever the case. No, I don't want soup today. I don't want. I just want a sandwich. It's much easier, much less wastage that way. Because just going back to food waste, I mean, I don't know the exact figure. I can't remember the exact figure, but it's around nearly 500 kilos per person per year in Australia. Food waste.
Wow.
There's wastage.
It's a lot of food if you could mountain that up and picture it.
So when you talk about a footprint and what you do about it, the first thing is mitigate, reduce that footprint. And this is around looking, say, the first thing is we use the 5 R's. Refuse.
Is this progress from the reduce, reuse, recycle, the 3 R's?
Yeah, the kind of 5 R's, and there'll be more. Yeah, we at Bond just go, there's the 5 R's, and you can fashion it any way you want. But the first one is refuse, because if you look at it as the pyramid like this, refuse. So if you don't need it,
I did that today. Someone said, "Do you want a bag?" And I'm like,
"No, thank you.
I'm going to talk about environmental sustainability today. Better not take the bag."
Yeah, so it's refuse. No, I don't need 2 pairs of gloves, or I don't need another reusable mask. I have a mask that I can use many times.
Take us back to the 5 R's. So we got refuse.
Yeah, so refuse, reduce, reuse, repurpose, refashion, and then the other one is rot, compost, right?
And that's the kind of bamboo.
Or just throw
Or
your
the-
veggie peels. Where do mine go? Bing, outside in the garden. I didn't even have a compost heap. I just throw them
in the garden.
Throw them in the garden.
Or let them rot.
Yeah, birds come and get them. And
So the repurpose one, I heard a good story the other day about. I heard about a lady in Melbourne who's reusing, in manual handling, we would train and use a lot of slide sheets and hoist slings, and she's repurposing them to transport injured animals. It started after the bushfires that we had in Australia. I thought that was a cool way to reuse
so
things.
a lot of
You donate and then
it-
she
it's-
circulates.
Yes, I know someone who works at Rabina who takes a whole lot of
Rabina Hospital.
Yeah, sorry.
I know what you're talking about.
Rabina Hospital, gloves and stuff like that. That goes when it's close to the sell by date, you know, the expiry date. They go to poorer countries so that they can be used. I mean, it's not being dumped. It's being used by someone else. They're not expired, but they sometimes people get a bit funny around it. Australia is quite litigious, and so something happened and a glove broke, and it was near the, you know, there'd be, you know, those sorts of things. But going back, if I go back to all these things like refuse, you know, suppliers are going to have to be much more conscious about the plastic, and so making sure that when you get stuff, it's quite sustainable. I've just changed all my super to Australian ethical, so divested from fossil fuels. So you can do that as an individual. Your business can do that if it's got shares. The green and healthy hospitals they've got a whole lot of things that you can do. There's a list of 10 things that you can do.
I'll put that in the show notes too. That's a website, isn't it?
And they have a website. So one of the problems is going to be in Australia is that our students are going to be geared and prepared to think about this.
And the workplace
is not going to be like that unless you go into in GP practice and that's run sustainably. But hospitals are going to take a lot longer to do that. Because they're all state run, right? Some of them are really good around sustainability, and different people have driven processes. In like Sydney, there's a whole green group. The PA hospital, you've seen they were on the War of Waste.
Oh, I didn't see it.
Oh, I must show you
the
that.
Princess Alexandra Hospital.
Exactly. And there was that guy did those programs on the War on Waste, and he went there, and all their from oxygen masks, they strip it, strip it into its different components, and the copper wire, it strips out, and they get the money that they make
back from the copper.
From the copper and from the PVC, and they also some of the stuff is sent to New Zealand, and it comes back as garden hoses.
Wow!
So they just got all of that set up, and it's all sorted, and it goes to different places.
And most hospitals, should have that now. They should have a environmental committee. Is that what it's called?
Sustainability, environmentally sustainable committee to look at how they do this.
So that would be an easy way to get involved and look at what's happening in your local hospital and
so
what can you do.
What the UK did was looked at hotspots. Theatre. Theatre is a hotspot, and I'll tell you a little bit more. Farm. Because if you look at
packaging in the packaging?
Just the footprint of pharmacy is in the Australian system, it's 19% of the total emissions.
Wow!
Because if you think about all the process, like from R&D all the way, production, water that's used, the packaging, now it's all blister packs, transportation. And then over-diagnosis,
and then the waste,
and over-prescribing.
Yeah, and then the wasted pills get turfed out and then back into the.
But there are you can donate them back. There are depots for that.
Okay.
I can find out and let you know what that is. There is I know from one of my collaborators who I've never met from QUT. She's a green pharmacist.
Wow.
So, that's so there's
happening
things
all
that
around.
all that can happen. It's easier if you're in a small practice because
To
you
control the
can make
elements
sure
and-
that your fridge has got 5 stars, that you've got solar, that all the lights are switched off, all the computers are shut down, because any red light that's on is trickling electricity. So when a screen stays on, it's still using electricity. When your TV stays on, it's using power. And because in Australia we're still focused on coal, I've got green energy at home. I don't have solar, but I buy green energy. So someone sold it to the grid, and I then use the green energy. So there's different things you can do.
Yeah. So it's individually and organisationally.
So I always talk about there's a personal responsibility to make a difference, and there's a professional responsibility. So with Australia's huge footprint per capita, we have to bring it down. But a lot of it is around people being unhealthy because there's obesity is or overweight, and obesity is quite high in Australia. And if we just ate properly, not so much of the fast foods, which uses lots of packaging anyway, we'd be better off that way. So I spoke about mitigation. The other one is co-benefits. So if you cycle to work, you're not producing carbon, and you're getting the exercise, the benefit of the exercise. So what is it we can do that benefits the environment and the health of the person? And then the last, the other one is adaptation. So when in some places it's just going to be so hot, you can't do anything. When you get temperatures of 45 degrees and people are fainting, what adaptation measures do you have to do? So if you're in Charleville or Birdsville on these hot days, you just got to make sure you look after the vulnerable, the elderly, the children, make sure they're well hydrated, they're inside, they're not out in the middle of the day, those kinds of things in terms of health. Water is going to be an issue, so you need to conserve water because the climate pattern changes. There's often droughts in the central area, and water is an issue. So
we have covered a lot of ground. I can see by the amount of topics we've covered how so much of this is interconnected. It's not just the health of humans and health of the planet. It's all in.
But if we go back to the Indigenous perspective, because I know one of the questions you want to ask me is how does it all come together? How does
explain that link between them all?
So if we are well, we have the well-being. If we're well, because we care for our environment, we go to nature. That's where we go. We need to go for mindfulness, to connect with others,
mental health.
Yeah. So if we are well, we're not going to go to the hospitals and to the doctors so often. We are going to not have we'll lower our footprint. In Canada, there's Park's prescription, and healthcare providers now prescribe time away for mental health and all sorts of other things, because there's such benefits, like your immunity improves, your and you're normally going to exercise. You're not just going to sort of sit there. Maybe you're going to read a book, but it's mindfulness, taking it in. But you're going to probably exercise, go hiking, look at birds. So it's a prescription for health, and they base it on an article that says they did nearly 20,000 people in the UK. So it's a fair size, yeah. And there's still some ifs and buts, like does it actually mean you have to do exercise? They've got more work to do, but it's 120 minutes a week. That's 2 hours a week. And it seems to be the time is between 20 and 30 minutes. A session
in nature.
Yeah, connecting with it. For me, if someone's got headphones in and listening to music and not taking anything in, it's not really connecting. I think it's about the mindfulness of it, is feeling. I walk past trees and I feel the bark. That looks interesting. That goes like this, and you take a photo of a tree because it looks like it's camouflaged, and just these shapes.
Immersive kind of experience.
Yeah, so it's called ecotherapy or nature therapy or nature-based therapy or forest bathing, all sorts of different terms. And so Indigenous people, First Nation people are connected. If they're on their land, their ancestral land, they're happy because they do what they do and they're connected to it and they look after it as a group, not as an individual. So it's connectedness and oneness.
Well, speaking of getting time to feel good, I know you've got a game of squash coming up, so I won't hold you up anymore, Michelle. I want to thank you for your time, and I'll put a bunch of links in the show notes from all the things we talked about and some of the research articles and the organisations that we mentioned. It's been a pleasure.
Yeah, thank you very much. I've enjoyed it.
So there's a lot of big brain energy in that podcast from Michelle McLean. Thinking about this post-pandemic world and talk of a green recovery, I think her message is really important. We all want a better future for health and our planet together. So spread the word and share this episode with any of your colleagues or friends, whether it's inside health or outside health. I think there's important messages and inspiration for us all. If you are part of an environmental healthcare group, please leave us a comment. We'd love to hear what you've been up to. You have been listening to the Manual Handling Collective podcast. If you're only listening through audio, we've also filmed this episode. If you want to see a little extra, see the link in the show notes. Subscribe to stay notified of future episodes. Like, share, comment, and get in touch to hear more of what you want. If you know a guest who'd be a great fit for the show, just let me know.